Hello, everyone. My name is Mumtaz Mahmood, and I would like to introduce this session today. It's an exciting evening for me, and I'd like to welcome everybody who's attending. You might be from different parts of the world, I know that. We have quite a few, about over 100 people registered in this webinar. So really thank you for your time and trouble to join us tonight. And I hope you will really enjoy the webinar. My name is Mumtaz Mahmood, as you know. I'm a volunteer IOSH committee member, and I've been a committee member for the past 6 years. And if you haven't joined IOSH and if you work in the field of health and safety, I would really highly recommend that you join IOSH. We already have 46,000 members throughout the world, and it's really worthwhile to join IOSH. My day job is with the London Borough of Tower Hamlets, which is a local authority in London, and I used to do audits for schools, and also audits for the different council departments. By audits, I mean health and safety audits. I would like to introduce Garrett Brown, who's our presenter and speaker. Garrett D. Brown, Master of Public Health. He is a certified industrial hygienist. Hello, Garrett, and longtime member of the American Industrial Hygiene Association and the American Conference of Governmental Industrial Hygienists. Brown worked as a field compliance officer for the California Division of Occupational Safety and Health for 18 years before becoming the specialist assistant to California OSHA Chief Ellen Wides. Brown retired from California OSHA in 2014, but has returned as a part-time retired annuitant to assist the agency in responding to the COVID-19 pandemic. In 1993, Brown founded the Maquiladora Health and Safety Support Network. I have to get the pronunciation right, which is a network of 300 occupational health professionals donating their time and expertise for projects with grassroots worker and community-based organizations in the developing world. Brown has been the volunteer coordinator since its founding and has organized projects with local groups in Mexico, Central America, the Dominican Republic, Indonesia, China, and Bangladesh. I met Garrett a few years back in London and also in Birmingham in the IOSH conference where he was a speaker. So I will hand over now to Garrett.
Great. Well, thank you very much, Mumtaz, and I would like to take this opportunity to thank both Mumtaz and the London branch of IOSH for the opportunity to speak today and also to speak later this month and in early February. Today, I'm going to be talking about, let me go back here, the OHS Initiative for Workers and Community, which is a 3-year, actually 4-year-old project in Dhaka, Bangladesh. What I'd like to talk about today is the context of the OHS initiative in Bangladesh, how it was founded, in part because one of my hopes from this presentation today is that it might inspire people to think about other similar projects in different parts of the world that could also use the help of OHS professionals such as ourselves. Then the structure, funding and activities of the project, and finally the impact and the lessons. Bangladesh, as you may know, is the world's #2 apparel producer. Only China produces more garments than Bangladesh. In the last fiscal year, the country exported $32 billion worth of garments, which represented 82% of the country's exports. So it is really a critical sector for the Bangladesh economy. There are about 4 million garment workers in Bangladesh. About 65% of them are female, mostly young women from the countryside that are coming to Dhaka, Chittagong, and other areas, which are their first urban and their first industrial experiences. Working in the garment industry in Bangladesh, unfortunately, is similar to working in the industry elsewhere. It's characterized by low wages and long hours. There's near zero regulation and enforcement of those, and there's a lack of political will, both on the part of the government, which is dominated by garment manufacturers, and also by the factory owners themselves. And unfortunately, there is a long history of industrial disasters in Bangladesh. This actually is 2005. This was the Spectrum sweater factory building that collapsed in 2005, killing 64 workers inside. Now, this was almost exactly the same thing that happened 8 years later in Rana Plaza, but unfortunately, the lessons learned from the Spectrum sweater fire were not learned by the owners and the government of Bangladesh. In addition to building collapses, they've had a long history of factory fires. This is the Hameen Group fire in 2010 that resulted in the deaths of 27 workers. It was an eerie reincarnation of a factory fire in New York City 99 years prior to that. In 1911, the Triangle Shirtwaist Factory burned in Manhattan in New York City, killed 146 women. And it was exactly the same scenario here. It was a fire on the 9th and 10th floors of this building. All of the exits to the factory were locked, and people burned to death, or they threw themselves off the top of the building to avoid the flames. Now, this, of course, is Rana Plaza, which I'm sure many people have seen this photograph. Here was a scale of death beyond anything else. It was 1,138 workers were killed in an instant. More than 2,000 were injured, and many of them permanently disabled as a result of the building collapse. This was a moment of reckoning, of course, for health and safety in the workplace in Bangladesh, health and safety in the garment industry around the world. Conditions which existed in Bangladesh also exist in other countries such as India and Pakistan, which have some of the similar sort of structures. So out of this Rana Plaza experience, there were many developments, one of which I'll be speaking about in two weeks, which is the Bangladesh Accord for Fire and Building Safety. The other development that occurred was there was a group of us in California. There were 4 organizations. We called ourselves the California Collaborative that wanted to take advantage of this moment to see if we could improve health and safety in Bangladesh in the sense of building the capacity and knowledge and activity of grassroots organizations in Bangladesh on the issue of occupational safety and health. And the 4 organizations involved have been very much involved in doing similar projects in the Americas and other parts of Asia, including China and Indonesia. So the 4 groups in California were the Hesperian Health Guides, based in Berkeley, California, that publish Where There Is No Doctor is their most famous book, but a couple of years ago, they published a Worker's Guide to Health and Safety, which is very useful. The University of California at Berkeley's Labor Occupational Health Program, the equivalent at UCLA in Los Angeles, the LOSH program, Labor Occupational Safety and Health, and then my own Maquiladora Health and Safety Support Network. And the goal of these 4 organizations was to build the capacity, the OHS capacity of worker and community organizations in Bangladesh. And there were some guiding principles behind this idea, which were, of course, fully embraced by the 6 partner organizations that ultimately formed this project. And it's important to keep these in mind, especially if you're thinking about doing similar kinds of projects in other parts of the world. The first principle is a focus on workers and their organizations. As OHS professionals, we know that basically there are 3 key players in OHS around the world. The first is government, which is ostensibly to promulgate regulations and enforce those regulations. Secondly, our employers who are supposed to comply with those regulations, develop their own customized on-site programs. And thirdly, there are workers who must play a meaningful and active and role in OHS programs if they're to be effective at the factory level. But as we also know, most of the resources in the world tend to go to governments and to employers. And there's very few resources that are available, especially in the developing world, for workers and their organizations, which are a critical third leg of the stool of OHS if it's to be effective. So the guiding principle for this project has been a focus on worker organizations and their communities where they live. Second principle was the use of what's called popular education methods for low literacy participants. In many parts of the world, working people are not able to take advantage of many years of formal education. They're perfectly intelligent and have a lot of experience, but they just don't have a lot of formal education. So it's very important that any health and safety training that we do is in sync with the level of literacy and cultural understanding of the workforce of the audience that you're trying to deal with. Thirdly, is we've learned over time is that local instructors with the critical language and cultural skills are really the most important. It's possible, as I've done many times myself, to be sort of a parachuting OHS professional who drop into Indonesia or China and do trainings, do technical assistance, and then leave. But the most effective, long-lasting impact is when there's local instructors that have the knowledge and the skills and the confidence to do the OHS work that we want to. And then finally, it was an important principle that this effort be led and directed by Bangladeshis themselves. Unfortunately, many international projects around the world are led and directed by the funders who tend to be in the US, the UK, or the EU. And the agency and the control of those projects resides with the funders and the international actors. And it was very important to us and to the Bangladeshis in this project that it was the local, the national Bangladesh folks run the actual project. So let me run down just briefly the 6 organizations that came to as a result of a year's worth of discussion. In 2014, 2015, a number of us from California went to Bangladesh to have a series of meetings with organizations to lay out the idea that became the OHS Initiative. And these were the 6 organizations that signed on for that effort. The first is the Bangladesh Occupational Safety, Health and Environment Foundation, called OHSI, which was founded in 2003. It's one of the few OHS nonprofits in Bangladesh doing training, research, and policy advocacy. And they have a long experience, as you might imagine, in training workers in Bangladesh around OHS topics, not only in the garment industry, but also construction, shipbreaking, and others, tanneries. The next organization was GK, which is a public health organization, was actually formed during the 1971 War for Independence, Bangladesh independence from Pakistan. And it's been a public health organization since that time. It operates full-scale hospitals and clinics in poor areas of Dhaka and other cities. And again, it has long experience in public health education training with poor populations. The third organization was the Bangladesh Center for Worker Solidarity, which is a grassroots labor rights and worker support organization that was formed in 2001 by former garment workers, women garment workers in Dhaka. And they also have long experience in training with workers, not on OHS, but on labor law and workers' rights. The fourth organization is the Bangladesh Institute for Labor Studies, which was founded in 1995 and remains Bangladesh's only labor institute as we understand it in the UK and the US. It has expertise on labor law and workers' rights under those laws. Again, training experience with workers, but again, not on OHS, but on labor law topics. The fifth organization was the Industrial Bangladesh Council, which was a council of more than 20 local trade unions in the garment, chemical, and metalworking industries. It's an affiliate of the Industrial Global Union, which is based in in Switzerland, and it includes a dozen local unions in the ready-made garment sector. And then last, but certainly not least, was Naripoko, which was a women's rights and support organization that was founded in 1983. And it has expertise on gender issues related to discrimination against women at work and in the home, and gender-based violence and harassment. And it has long experience as well in training women from working in poor communities. Again, not on occupational safety and health, but more on women's rights issues. So this was the founding meeting of the OHS Initiative in October of 2015. As you can see on the left, there's a work group of all the 6 organizations that were there trying to hammer out what would be the governance structure and the activities of the organization. And after the agreement was reached, here's a picture of everybody involved. This gentleman, if you can see my pointer, is Todd Jailer from the Hesperian Health Guides in Berkeley, and here's me present as well. The goals of this joint project between the 6 organizations was to generate over the course of 3 years 75 master trainers from the 6 organizations. And that these master trainers would conduct community level OHS workshops with 6,000 workers and community residents during the first phase of the project, the first 3 years or so. And during the course of that activity, the OHS Initiative would develop accessible and accurate OHS materials for a worker and community audience. The initial tasks were to register the project with the NGO Bureau in Bangladesh, which is a long bureaucratic process. I'm sure many of you are familiar with it there and other parts of the world. So that took basically a year, from October of 2015 to October 2016, to get the registration taken care of. And we also established a governance structure, which was a governing board, which was a representative of six people, a representative from each of the 6 organizations, and a 7th representative, which was myself, from the California Collaborative. Hiring of the staff began in January of 2017. The first 4 staff members were a project coordinator, a training manager, and then administrative and financial staff. And then, of course, like any project, the big issue is raising the money, which we decided to do on a year-by-year basis. So that task was actually taken on completely by the California Collaborative. It was our thought in California that if we could take on the responsibility of raising the money for the project for those first 3 years, then the staff in Dhaka could focus on the development of the curriculum, the materials, the training, the recruitment of the participants. And that's how it worked out. We were very successful in the sense that we raised nearly $250,000 US dollars over 3.5 years. And there were some key funders involved in that. IOSH itself was, of course, a founding contributor, a founding funder of the OHS Initiative. In fact, donated 5,000 pounds for 4 years of the initiative's existence, which has been really a key aspect. There's the World Solidarity Movement based in Belgium. Also a contributor, Lush, believe it or not, is a cosmetics company in Canada. And they have a charity pot which gives up to $25,000 a year in donations for projects involving women, benefiting women. And as a result, they were contributors over this period of time as well. There was a group of progressive donors in San Francisco, a couple of foundations, the Global Works in the United States, and the CNA, now the Louds Foundation in the EU. Some OHS organizations in the US, including the American Industrial Hygiene Association and the National Fire Protection Association, and then many, many individual OHS professionals around the world, primarily from the US, contributed. So we were able to fully fund the first 3.5 years of the project. So the project, the educational activities while we were doing the fundraising that first year, included a needs assessment, which was a very thorough, comprehensive interviews with the 6 partner organizations to find out what exactly they hope to get out of this project, what were their needs and aspirations. Secondly, there was a curriculum development committee, which included experts from each of the 6 organizations and their areas of expertise, but also outside experts, including a brigadier general who had been in the National Fire Service and was now part of the National Industrial Health and Safety Council, as well as universities from university professors from North-South University and Dhaka University. The participant recruitment from the 6 organizations began in 2017. That was the first class, the second class the following year, and the third class in 2019. Each of the 6 organizations contributed or nominated 5 individuals to be part of the training team. And the educational sessions that were organized for each of these classes consisted of a basic training of trainers, that's the ToT, that lasted 20 days, a refresher training several months after the basic training of about 5 days, and then periodic training network meetings of 1 day to have the trainers meet and the various classes come together. So this is a picture of this, the opening session of the second basic training, ToT training in 2018. The man who's speaking is the Asia coordinator for the World Solidarity Movement from Belgium. So the basic ToT, just to give you an idea, especially if you're thinking about how this might work in other parts of the world, was a 5-day residential training, meaning that the 30 training participants met in a separate location. There was a GK facility in the city of Savar, which is just outside Dhaka. They met there for 5 days for full-time training, and then 15 one-day sessions over the 2 to 3 months following, because most of these people were either workers or they were staff members of the organizations or staff members of community organizations. So these 15 one-day sessions also included a field day at an operating garment factory to practice their hazard recognition skills. And this field day was led by the Deputy Inspector General of the Ministry of Labor's Department of Inspection of Factories and Establishments. So we had an opportunity for the 30 participants in the training to actually accompany government inspectors around an operating factory. There were 16 modules that were both of OHS and non-OHS topics, and all of this was in preparation for the master trainers conducting their own community level workshops. So the OHS subjects that were touched upon and explained during the course of the ToT are ones that we're very familiar with as OHS professionals. I won't read them out, but you can see always the standard sort of activities. The non-OHS topics were also very important for the participants, the trainers, so that they have the skill set and most importantly, the confidence to know that they can put on their own trainings on a community level. So there was information on how to do effective popular education style trainings on a community basis. What are effective training methods and techniques, information on the labor law, workers' rights, the role and function of government agencies, principles of effective communication, which is critical for any activity, and then conflict resolution skills. Unfortunately, many workplaces in Bangladesh are very conflictive, and having the ability to resolve, hopefully without people getting fired or physically attacked, conflicts with supervisors, managers, and owners is a critical skill. So in addition, there was sort of, I think, a major advance for OHS in Bangladesh in that gender was treated as it is in growing numbers of the world, including the United States, I'm sure the UK, that gender issues are considered OHS issues as well. And this is particularly important for a workforce such as the garment workforce in Bangladesh, which is overwhelmingly female. So part of the training related to information on reproductive health hazards for men as well as women, Gender-specific issues, like, as we're all familiar, that many personal protective equipment does not fit women because they're not designed, unfortunately, for women, and what can be done in that regard. Gender-based harassment and violence, unfortunately, is endemic and very prevalent in the garment industry in Bangladesh and in other workplaces as well, as it is in other parts of the world, including the United States, for that matter. So women's rights under the law were also part of the curriculum, and women's role and leadership in a factory committee was also part of it. So I think this is a real advance for occupational health and safety training, it's particularly on a grassroots level, to incorporate the gender aspects of OHS. Now, there were expert instructors, both for the ToT and later forms of instruction as well. There was in-house experts from OHSI on health and safety, from GK on public health and medical issues, from bills on labor law and workers' rights, and then Naripoko, as I mentioned, on women's rights and gender issues. But there were also outside experts who were volunteer instructors, which included universities professors from Dhaka University, North-South University, the Brigadier General I mentioned from the National Fire Service, top officials from DIFE, which is the Department of Inspection of Factories and Establishments in the Ministry of Labor, and also experts on OHS from the Dhaka office of the International Labor Organization. So the teaching methods were, as I've mentioned, popular education style for low literacy participants. And this includes, a variety of techniques, including lectures, audiovisual case studies, and small group activities where the groups are assigned particular tasks. The most important aspect of popular education is to understand that the participants have their own real world experience and have real world expertise. And it's important to start from that point and go further. And that many people, especially adults, learn best by doing things rather than sitting and listening. So the more interactive, participatory the trainings are, the more effective they are. So for example, these are some small group activities that took place during the ToT, where a small group would be given a task either to analyze a material safety data sheet of a particular chemical in use as a solvent, for example, in the cleanup of garments, or for example, analyzing the hazards of a particular process or set of machinery and the like. And so the groups would discuss these issues, and eventually they would put down their conclusions and recommendations out of the small groups, and that those would then be presented to the large group as a whole. So you would have each of the 5 or 6 groups, depending on how many people were in it, update what their recommendations and plans were, and that in this way sharing information that was gleaned from each of the small groups to the larger group as a whole. The training materials, of course, included a Bangla language training manual. All of the materials, of course, were in Bangla, but you have a training manual for the 16 modules that were presented. There was also separate lecture notes, session handouts, especially the materials that were used in the small groups, guidebooks of the national laws that were provided to each of the participants. And then there was also electronic resources developed over the course of the 3-year project, that there were 19 separate videos that were posted on YouTube that included the presentations by the major instructors and some of the report back activities from the small groups. There was a closed Facebook page for the graduates of the program, the 3 classes of trainers, so that they could exchange experiences and materials, tips. And finally, at UCLA, the Labor Occupational Health Program put on its webpage a resource page of Bangla language materials, which of course is available to everybody on the web. So the refresher training, this was a refresher training for the first class of master trainers, which took place in the spring of 2018 after their 20-day ToT in 2017. And the training there for a refresher was basically a 3 to 5 day training sessions. Some of the favorite topics are listed there, the things that the trainers felt they needed to get more information or refresh their information about, so that they would feel confident in producing and conducting the trainings they do on a workshop basis in the community. And as I mentioned, as they exchanged experiences from conducting their own workshops, and they developed out of the course of these refresher trainings a standard 2-hour community training curriculum and the materials for those that each of the trainers could then use for their own trainings on the community level. So you can see here just a couple of pictures. Here's a woman in 2019 who was explaining the successes and also the challenges of the community level workshops that she had done over the course of the previous year. And this was another small group activity during the training network meeting to advance the development of materials to use on a community level. So there were also some special sessions, one-day sessions on youth and OHS, because as we know, young people everywhere around the world, including Bangladesh, have higher rates of injuries and illnesses and fatalities than older workers do. A special session, a couple one-day sessions on gender and OHS to reinforce the issues that we talked about earlier of reproductive health, but also gender-related harassment and violence. There was a special session on women leadership skills and OHS, which grew out of the second gender and OHS, so that women could develop their skills to play more of an active role in the legally required health and safety committees in the factories, and also into the now legally required anti-harassment or gender violence committees that are in factories as well. And there was also a seminar on employment injury insurance and labor law, which is under consideration in Bangladesh. The project results were really met the goals, I'm happy to say. There were 88 master trainers who were developed from the 6 partner organizations, and 83 of them are still active. 5 people either left their organizations or went back home into the countryside. And 47 of those 83 active master trainers are women. Community level meetings from 2017 to 19 included more than 200 meetings. There were more than 4,000 participants from 170 factories in 5 neighborhoods that were taught these workshops by the master trainers. And the trainers helped workers in 2 factories form legally recognized unions. Now, all of that, of course, unfortunately came to a screeching halt last spring when COVID hit Bangladesh, and it's still in a very dire situation. But because of the work that had been done by the initiative in terms of developing this network of master trainers, of the joint work of the 6 organizations, which were recognized nationally and internationally by funders, there was a special grant provided to the OHS to start a COVID emergency response project that lasted from June to December of last year. And it was funded by grants of $110,000 US from the Louds Foundation, the Lush Charity Pot from Canada, and my organization contributed as well. And this emergency project consisted of neighborhood distribution of food, medicine, and information about COVID, which reached 720 families and produced 5,000 brochures, which were distributed in the neighborhoods. There were 3 mobile clinics that were staffed by medical personnel provided by the GK organization, who then, after the 1-week clinic, also did house visits, follow-up visits, and they served 13,500 people during that 6-month period. So here's a couple of pictures. This is the food distribution and medicine distribution in part of Dhaka, where women, many of them heads of households, single mothers, were able to receive support. This is one of the mobile clinics that was set up in the offices of OHS in the Mirpur district of Dhaka. So the emergency response, as I mentioned, they had 3 locations that were organized by different partner organizations from the initiative. There was also a medical hotline that was operating 24 hours a day, 7 days a week, that were staffed by 2 MDs, one a woman, one a man. and they responded to 5,400 callers during the course of this period of time. Another innovation that was developed by the OHS Initiative staff was the development of a psychological first aid program. As has become well known in the US, and I'm sure in the UK as well, there is a big impact with all the lockdowns from COVID in terms of increased levels of anxiety, depression, suicide, and domestic violence. And so developing a psychological first aid program as part of the clinics, as part of the hotline, was an important innovation by the initiative during this emergency response program. So the project impact, I think, also met its goals. I'm happy to say that there was an increase in OHS knowledge and capacity and activity in the 6 partner organizations, all of which had, full bore programs interacting with worker communities before, but now we're able to add into their repertoire OHS activities as well. There was increased awareness of OHS in the worker communities where these clinics and community level workshops were being trained, were occurring. And then of course, there was increased participation and effectiveness in terms of the participation of workers in factory OHS activities that have participated as master trainers or in the community level workshops. So I thought I would just share 2 testimonies, as it were, from participants in the OHS training of trainers. This was a young man who had been a rescue worker at the Rana Plaza disaster in 2013, and he participated in the first group of master trainers in 2017. And he said, as you can read here, "I've thought to myself many times what I could have done to prevent such an occurrence. This training has been a revelation to me. I learned many new things that I never would have known. It will be very valuable if we can disperse this knowledge among workers. In the end, real change will occur only when they demand it." Another testimony from a young garment worker who participated in the second class or second cohort of trainers. And she said, "Before the training, I knew how unsafe our factories could be, but I lacked concrete knowledge. I wasn't able to actually tell workers specifics about the kinds of risks and what they do if they came across such risks. Even a simple chair can have a lasting impact on your health. Most importantly, the workers deserve better than just to accept everything handed to them." So I think these are and there are many other sort of testimonies of this nature, both by the trainers, the 83 master trainers produced by the initiative, and also by community residents who participated in the workshops. So the lessons I think from this project, and I'll end with this, is that the joint activities by diverse but related organizations are stronger and more effective often than even activities done by a single organization. Secondly, that the need for OHS knowledge and capacity at the grassroots level is critical and unmet, not only in Bangladesh, but in many parts of the world, including among many worker populations in the United States and the UK, I would venture to say. And finally, that the OHS professionals everywhere can make a meaningful, substantial contribution to occupational safety health on a global level by projects of this nature, which are developed by IOSH and the AIHA and other organizations that we all belong to as part of our profession. So what's next is that the OHS initiative in Dhaka has completed its first 3 years, the first phase, and is now in the process of contemplating what a second phase would look like for the 6 partner organizations, building on the experience and the achievements of the first 3 years. But as I mentioned at the outset, there are plenty of places around the world where similar projects are needed and could make a real contribution to worker health and safety. And that's true in the garment, global supply chain, but also in electronics, in toys and leather goods, you name it. The global economy has lots of places where occupational safety and health, as we know, is barely known. So I will leave it at that. This is my contact information. Please feel free to send me an email if you have any questions about this. We do have a list. This is the website of the Maquiladora Health and Safety Support Network, which has got a section on Bangladesh and on the OHS initiative as well. So there's a number of materials there, including 6 or 7 rather updates on the OHS initiative over the last 3 years, which give more details as well. So back to you, Mumtaz, and I'm happy to try to answer any questions or interested in your comments.
Thank you so much, Garrett, for giving us an excellent insight into the occupational health and safety at work in Bangladesh. Really, really good. And I hope there will be participants who will be interested to do things. I don't know what, but I think we haven't had many questions, but I will ask you a couple of questions. That one of them is from Mr. Saeed Khan. He's asking whether there was any support. I think by that he means financial support from the Bangladeshi government in funding for this program or not.
Yeah, there wasn't financial support from the government, but there was obviously support in the sense that there were, as instructors in the training of trainer, a number of people who came from the Ministry of Labor, the Department of DIFE, the Department of Inspection of Factories and Establishment, who I mentioned had led the one-day field trip and the one-day preparation for that field trip in all of the 3 classes. And there were also other members from the Ministry of Labor who participated in as instructors on toxicology issues, on chemical management and the like. So there wasn't financial support, but there was support in the form of training resources.
Thank you for that. There's another question from Judy Barcelo. And she says, are you contemplating assessment of hazards in work sites before and after exposure to the training?
Well, you know, most of these trainings were done on a community basis as opposed to a factory basis. It may not have been clear from the presentation, but so the problem is, as we all know, in order to get access to a factory, you have to have obviously the approval of the owner of the factory to gain access and to actually work with the employees and the managers and supervisors there. In Bangladesh, as is in the case in the United States, there are many employers or factory owners that are not interested in having outsiders come into their factories, especially if those outsiders are going to highlight problems that they may not have the ability or the resources or the interest to address. So yeah, there's a decision that has to be made in a project like this, whether you're going to depend on factory access, which depends on the approval of the factory owners, or whether you will try and access to the factory workers themselves where they're able to be found, which is in the communities through their organizations, be they unions, worker centers, faith organizations, whatever. So we decided on the latter course. There are many, many projects that have been done in Bangladesh by the ILO, by the many brands, garment brands themselves, by governments from Canada, the Netherlands, the UK, et cetera, that have dealt with, again, governments and employers, but our focus was on workers. So what we tried to do, because we couldn't look at the conditions beforehand, was to survey the workers, the participants rather, to understand what their knowledge of OHS issues were prior to the training and what their knowledge was following the training. And we found, as you might imagine, a marked increase in the understanding and of OHS concepts and information before and then after the trainings. And of course, these trainers then went on to do their own trainings following a refresher and then the network training meetings, trainers networking meetings, sorry. So during the course of this, there were many times and opportunities for the trainers, the master trainers, to enhance their knowledge and to also use it in a way and to explain it in a way that would be accessible and meaningful to a worker population, which were in essence their peers, people they know and came out of the same circumstances as they did. So we were not able, and we didn't actually design it to go into the factories. We were able to do an evaluation of the impact and the development over time with the trainers and the people they're interacting with.
Thank you for that. We have a few questions coming in. There's one question from Lawrence Webb. He says, it was good to see that in the early stages, some support, soft skills training was provided to those involved. This is essential to help facilitate occupational safety and health theory into practice and support those who are engaged to be both confident and able to implement knowledge gained. So that's like a statement.
I agree completely. I think that's absolutely important, critical for the success of this project, is that the master trainers got that level of non-OHS information and skills, which allowed them to effectively convey the OHS materials we're so interested in having
Another question from Shamim Ahmed. Hi, I'm a PhD student at the University of Toronto, and I'm doing my PhD on female ready-made garment workers' health practice in Bangladesh. I'm curious to know whether you found anything regarding the role of husbands in the decision-making process of garment workers, such as income, expenditure, and thank you for the nice presentation.
Well, I think probably the best organizations that you might want to communicate with on that issue would be Nari Poko in Bangladesh, which is, as I mentioned, a long-standing women's rights organization that has, a huge staff of community. They have about 50 people on staff who do community work, and they have a long experience with that. The other organization you might communicate with is the Bangladesh Center for Worker Solidarity, which is an organization primarily of women garment workers. And those two organizations I know are very closely in touch with the women garment workers in a way that, frankly, I'm not in California. But having read some of the literature and certainly having read some of the testimony, I know that a society in which women put it in one way, are often viewed as second-class citizens and are under the control of men in their family, be it their fathers first, their husbands, even their brothers and the like, uncles, that these institutions that are cultural and in character have a big impact on people's lives. But I don't consider myself to be an expert on this at all. I'd recommend that you communicate with Nari Poko and the BCWS.
Just to clarify, Nari Poko means support for women in Bengali. There's another question from Regina Keenan. She says, the trainers have really stayed with the program, which seems a huge plus. What do you think were the main challenges to setting up and maintaining the program?
Well, I would say there are a couple challenges, and we actually have if you go on the My Little Networks website there, we have the updates from the OHS Initiative, and about a year and a half ago or 2 years ago now, I did an interview with the project coordinator asking him what would exactly be these challenges. And there's several, one of which, of course, is funding is always a big issue, though those of us in California were able to help out in that regard. Secondly, coordination from 6 organizations is hard. I mean, it's kind of very remarkable to me, because the idea that you would get 6 organizations in the US to work together with one another over 4 years and share money and share responsibility and the like, that's pretty unusual in the US. And I assume it's not that usual in Bangladesh. So I think it's the skills of the project coordinator who were able to facilitate that, plus the commitment of each of these organizations to actually make this project go forward, which it did over the last 4 years. But coordination of the partner organizations is hard. And then, of course, working with a grassroots population, you're dealing with people who work basically 6 days a week, oftentimes 12 hours a day, sometimes 14 hours a day. Many of them are women that are either single heads of household or have tremendous double duty in the household. They have to cook, they have to clean. So finding time that those individuals would have time to become master trainers, to do the 20 days worth of training in a ToT and another 5 days in a refresher training. And then for them to find the time for their neighbors and peers to do what usually was a 2 to 4 hour community level workshop on health and safety, that was a real challenge. And then the final would be to have the appropriate materials. That's one of the things that came out of the refreshers and the trainer network meeting, is that they all who were doing these workshops, community level workshops, got together and put together a standard 2-hour curriculum and activities for the community workshops, which means that every trainer did not have to reinvent the wheel, but could customize this standard format for the audience and the participants they had that day in the community level workshop.
Thank you. I think we have one last question from someone called Gania Trotter. What are your major financial or other needs? Do you have a financial goal? And then it says, let's move down. Sorry. Yeah. Was that, could you understand that?
Yeah. Well, as I mentioned, the initiative has completed its first phase, the 3 years of the OHS program and then half a year of the COVID emergency response program. So here we are in the first month of 2021, and the governing board will be meeting. That's the 6 members represented from each of the organizations, and then me as a representative from the California Collaborative at the end of the month to go through the various options that are developed for continuing the project the way it has been, changing in some way or another, adding additional aspects to it. And then once we've established what we want for the activities, then we'll have to go out and do the fundraising for it, which is always the case. There is a track record for the initiative now. It's had 3.5 years, I think, of quite successful activity, for less than 100K a year, which I think is, international funding projects, that's nothing. That's like, vending machine money for big foundations and the like. But we'd have to figure out which foundations or which governments would be interested in doing this. And now that we've proven that it's a model that can be effective, we need to try and find the funders of a larger scale than those of us in California that could sustain this over a longer period of time. So we did our best over 3 years, but I don't think we're in a position the way things are in the US at the moment to raise that kind of money now. So we'll need to, once we have the activities in mind, figure out what it is that the funding sources would be interested in those kinds of activities.
Thank you, Garrett. I think we have time to take a couple more questions. One of them is from David Curtis. He's saying that I'd be really interested to hear if many or any issues came up related to people with disabilities. Any specific OHS issues relating to this? Just interested to know.
Right. So, of course, following Rana Plaza, where you had, 2,000 workers were injured, some of them with, crippling permanent disabilities that, and that's only Rana Plaza. There are many factory fires where people are also trampled or fall out of buildings and they're terrible situations. So disability for working is really a big issue in Bangladesh. Unfortunately, there's very little government support, in terms of disability payments. There's not much in the United States for that matter, but there's almost nothing in Bangladesh. So it's an issue. Most people who are disabled, unfortunately, are not in the workforce anymore. They're excluded, rightly or wrongly, by the employer. And so they're in a situation of just unbelievable desperation to feed themselves and their families. But the issue of prevention of disabilities, of course, is a big issue in any OHS program, both immediate problems in terms of machine guarding, but also in long-term problems with ergonomics or repetitive motions, which lead to musculoskeletal disorders, et cetera. So there is an aspect of looking at the prevention of disability. I would not say that disability or the disabled workers has been an aspect of this program to date.
Thank you, Garrett. One last question from Said Zebal. Can you tell us in brief about the experiences or feedback from occupational safety and health situation in Bangladesh tannery factory workers? Do you have any findings? I believe this person actually works in Bangladesh, so he's interested to find out about the tannery.
Yes, well, our focus, the idea behind setting up the initiative back in 2015 was that we would start with the garment and then we would look at expand it, into other industries, including tanneries, which are even worse, I think, in terms of occupational health hazards than the garment industry. Also construction or shipbreaking. I mean, all four of those are very dangerous occupations. To date, we haven't had the bandwidth and the funding to go beyond garment production. So I'm not that familiar with tanneries. I mean, I've been to old Dhaka before they moved many, but I'm sure not all of the tanneries out of old Dhaka to the new location outside the city. And I'm familiar with some of the literature around hazards and tanneries, but this project to date has not yet been involved in tanneries as much as I would like to be. And I'm sure everybody in Dhaka would like to as well, given the really horrific levels of exposures and injuries that occur.
I think we've got 2 minutes left. Maybe I'll see if I've got the last question. From Juan Lagos, any workers union in Bangladesh, did they contribute? I think they did, didn't they? Right.
So one of the 6 organizations was the IBC, or the Industrial Bangladesh Council, which is affiliated with the Industrial Global Union. They participated as a full member of the project, and they nominated 5 people to become master trainers in each of the 3 classes. We did not get any financial support from the union or from their the parent organization in the UK and the EU, but they were fully participating in it. The situation, as you know, for unions in the garment industry and anywhere else is very limited in Bangladesh. If there's 4% of garment workers belonging to a union, that would be the top end. So we're dealing with 95, 96% of the population has no unions working in these plants. So yeah, that's the reason why we looked at a community-based approach to both the training and the building of the knowledge. But the unions that do exist in the IBC were participants in the project and are members of the governing board.
Thank you very much, Garrett. I think you're probably very tired of talking. So I should formally thank you from the London Metropolitan Branch of IOSH, really sincerely from my heart. And we should end the meeting here. Thank you, everybody, for attending. Thank you.
Thank you. Bye-bye.